Grassroots Grassroots Advocacy webinar. We are so grateful that you took the time out today to be with all of us. My name is Leah Barber, and I'm the Director of Grassroots Advocacy with NORD. I joined this dynamic team in October, and I'm based in St. Petersburg, Florida. I have spent the bulk of my career advocating for access to quality, affordable health care for those in need. It is truly an honor to serve the rare disease community in this role and to be here with all of you today, so thank you. Today, we're going to talk about NORD's grassroots advocacy programs and our federal rare disease policy priorities. We will also roll out our state report cards, which is a vitally important advocacy tool that we hope that you will all use in your states. We will discuss ways for advocates and volunteers to get involved in our grassroots advocacy efforts and tell you about an urgent congressional call for action where you can make your voices heard on Capitol Hill today. I wanted to mention a few housekeeping items before we dive into our presentation. The meeting is being recorded, and we will send out the recording after the call with links that we will share today in the chat. We ask that you please use the Q&A function of the webinar to ask your questions to our panelists rather than the chat box. We will answer questions at the end, and we will do our best to get to all of your questions. If we don't answer your question, we will get back to you after the webinar in response because we would like to be mindful of everyone's time. The chat function is open for community members to connect with each other. We would also love to hear your name and where you're calling in from. We do appreciate the chat being kept to a minimum so participants can focus on the presentation. I'd like to thank Darby Gavin, who is our Senior Community Engagement Manager, for managing the logistics of this webinar and for everything that she tirelessly does for the rare disease community. Next slide. These are our panelists for today's discussion. They will each take a moment to introduce themselves to you when they present their sections. Next slide. As many of you know, the mission of NORD is to improve the health and well-being of people with rare diseases by driving advances in care, research, and policy. NORD is proud to be the annual U.S. sponsor of Rare Disease Day, which takes place on the last day of February each year. The goal of this day is to raise awareness of the over 10,000 rare diseases that impact over 300 million people globally. As many of you also know, in medicine, zebras represent the uncommon answers. When a medical professional hears hoofbeats, they are encouraged not just to assume it's a horse, but to consider that it could be a zebra. We show our stripes in solidarity with rare disease patients and families and to raise awareness of the challenges that they face. Next slide. Our volunteers, advocates, and stakeholder partners have planned awareness events throughout the U.S., as well as lobby days to educate and empower lawmakers to stand with the rare disease community on our pressing public policy priorities. Please visit rarediseaseday.us to learn more and see how you can get involved on this Rare Disease Day. Next slide. NORD's Rare Action Network, also known as RAN, is comprised of over 20,000 grassroots advocates. The Rare Action Network serves to connect and empower a unified network of individuals and organizations with tools, training, and resources to become effective advocates for rare diseases through national and state-based initiatives across the United States. Next slide. If you are not already a RAN member, please sign up today to participate in community public awareness and educational activities, digital action alerts, legislative advocacy, and connect with others with shared experiences. We will include the link in the chat. Next slide. Our RAN state ambassadors are our volunteer leaders located throughout the United States. They work to increase outreach and engagement with members of the rare disease community in their states through grassroots organizing, community education, and public awareness efforts. Our RAN ambassadors capture and communicate the experience and struggles of rare disease patients and families through sharing their healthcare journeys and encouraging others to do the same. Next slide. Now, I am very proud to introduce one of our fearless RAN ambassadors to all of you, and she will share her experiences and insights with you. Please meet Mindy Burnworth, who is NORD's Arizona State Ambassador. Mindy, thank you so much for being with us today, and I will turn it over to you.
Well, thank you, everyone, and especially Nord for the invitation to join today and share about my advocacy experience. And to all of those that have logged on today, thank you for taking the first step to advocate either for yourself or for your loved one. So my name is Mindy Burnworth, and I serve as the Volunteer Arizona Ambassador for the Rare Action Network, which is powered by the National Organization for Rare Disorders. But I'm also a hospital pharmacist, a professor of pharmacy practice at our local College of Pharmacy, but most importantly, like many of you, my touch or impact with rare, I'm the auntie of a rare niece with fiery red hair who blessed us for 12 days. So you see, much like you, I do have a personal connection to rare. I am one of the many grassroots advocates in Arizona. So when I was thinking about my 4 key talking points, I wanted to talk a bit about training of the next generation, being involved at any level, fear of the unknown, and knowing the resources. So as we go to the next picture, I wanted to share a little bit about grassroots advocacy. And when we think about grassroots advocacy, it really empowers ordinary citizens, much like you and I, to influence public policy and drive change from the ground up. And we can do this best by storytelling and getting others involved. And that is where it comes into training of the next generation. So on the left-hand side, you see 2 future pharmacists that are sharing about rare disease resources. And on the right-hand side, you see the Arizona Rare Action Network in action at one of our Rare Disease Day advocacy events. And you see that we span from our representatives, a zebra, all the way down to our children as well. So when we think about advocacy, small acts of advocacy, when they're multiplied together, can really transform the rare world. So if we look at our next picture, I wanted to talk a bit about advocacy at all levels. Now, many times I think when we think about advocacy, there may be a negative connection because we think political advocacy. But in reality, it's simply storytelling and sharing of our lived and loved experiences for those that have the rare disorder or the caregivers of those with the rare disorder. So you can advocate within your community, even within your family. You can talk and share your story all the way up to the state legislature. So we see on the left-hand side one of the Arizona Rare Action Network events where we painted our Arizona state capitol black and white zebra stripes. And most recently, myself and some of the other Rare Action Network volunteers had the opportunity to talk about the Rare Disease Advisory Council, or RDAC, right here in Arizona. And 30 other states have already implemented the RDAC. But really, it's about sharing the story of why are we advocating for the rare community? Why are we advocating for these individuals? And when I think back about my advocacy journey, I think the one thing that really held me back initially was the fear of the unknown. So for any of you that have teenagers out there, FOMO, the fear of missing out, is something you're probably familiar with. But I had the fear of the unknown. I didn't know how my story was going to be, how well people would respond to my story about being impacted by a rare disorder. But once I kind of overcame that fear of the unknown or fear of information uncertainty, I think I really found my calling in being a rare advocate. So, as I close today, I wanted to encourage all of you, don't fret about the fear of information uncertainty or the fear of the unknown. Nord and the many colleagues that are speaking today, they really will lift you up and empower you with the resources. And I will leave you with one small action item. Do one small act of advocacy today, whether that's telling a family member, a neighbor, or your state representative your story about rare disorders. Do one small thing today to start that massive movement and the change that we're hoping for. So, thank you for your time today, and thanks, Zebra.
Thank you so much, Mindy, for your inspirational words and your dedication to the rare disease community. You are truly making a difference. I think we should tell the teens that we have come up with something much cooler than FOMO. We'd like to thank all of our NORD ambassadors, volunteers, and grassroots advocates. We could not do this important work without you. We are now going to move into the policy education portion of our webinar with the introduction of Victoria Gem, NORD's Director of Policy and Regulatory Affairs. I'll turn it over to you, Tori.
Great. Thanks so much, Leah, for that introduction. As Leah mentioned, my name is Victoria Gem, and I'm the new Director of Policy and Regulatory Affairs here at NORD. I joined last month, and I'm really thrilled to be joining such a wonderful team here at NORD and really to have the opportunity and honor to help elevate the voice of the rare disease community through our policy team's work. So I'll start with a really brief overview of the current policy environment and some of our federal level policy priorities for this moment. Then I'll pass it off to some additional team members who will share some more deep dives into specific topics. As you likely know, this January, in addition to a new presidential administration, we have the start of a new Congress. This means that there are many new decision makers as well as key staff across the federal government who can benefit from learning more about the rare disease community as well as the policy priorities NORD is championing on behalf of those living with rare diseases. So we are closely monitoring the impacts that the new administration's actions as well as sort of Congress's priorities as they begin to shape up are having on the rare disease community, and we're engaging sort of an ongoing manner with decision makers on both sides of the aisle to make sure that we're advocating for the needs of the community during this time in a nuanced manner and in a way that makes sure that we preserve and promote the priorities of the community. As these priorities of the new administration and Congress become more clear, we're iterating on our own priorities to make sure that we can advance the things that matter most. You may be hearing of note about a legislative process called budget reconciliation that I just want to take a moment to highlight for you. Reconciliation is a tool that Congress can use to pass through major legislative policies in an expedited manner that have an impact on mandatory spending, revenues, and or the debt limit. The Republican majority in the House and Senate, in addition to a Republican presidential administration, really makes the reconciliation process possible. So Congress has already taken steps to start the reconciliation process, and Republicans are looking to utilize this to really advance administration priorities, including tax cuts. And this will need to come at the expense of spending cuts elsewhere in the federal government. So you'll be hearing more about that later on in the presentation. So one more note before we go to the next slide. It's important to note that budget reconciliation is a separate process from the annual spending bills Congress must pass in order to fund the federal government that you may be aware of. So next slide, please. So with that background, I did want to turn to our sort of immediate federal priorities. So as you may recall, Congress did not ultimately finalize spending for this current fiscal year that we're in. Last December, a large end of year spending package that included several NORD policy priorities did not ultimately get signed into law. Instead, Congress passed a stopgap measure called a continuing resolution that extends prior funding to this March 14th. And so as such, our policy priorities that were in that end of year spending package and which garnered broad bipartisan support during the last Congress have really rolled over into our top level federal priorities for this year. And we're engaging with this new Congress to urge them to get these important policies across the finish line. So these priorities do include things such as the Accelerating Kids Access to Care Act, Telehealth Modernization Act, and Innovation in Pediatric Drugs Act. I won't dive into it. I know some of that's on the slides, just given the limitations in time today. But I did want to highlight two of these priorities on the slides that would preserve some important incentives for rare disease research. So the first one there is the Creating Hope Reauthorization Act. This reauthorizes the Rare Pediatric Disease Priority Review Voucher Program, and that's a vital incentive for rare disease drug development for children with unmet treatment needs. And then the other one I wanted to highlight here is the RARE Act, which really cements FDA's or the U.S. Food and Drug Administration's long-standing interpretation of how to properly award orphan drug exclusivity, and that's really a key drug development incentive that was established by the Life-Changing Orphan Drug Act. So next slide. Great, thank you so much. And then here's just a bit more details, in particular on that Rare Pediatric Disease Priority Review Voucher Program. Just for those of you who are not familiar with this program or would like a refresher. So the Rare Pediatric Disease Priority Review Voucher, or PRV program, it is quite a mouthful, so the shorthand does help, has helped bring over 50 rare pediatric disease treatments to market since 2012. Companies that develop novel therapies for rare pediatric diseases can be awarded a PRV, which allows the drug review process to be shortened from 10 months to 6 months. That can really mean speeding access to a new therapy to market. And for companies that get awarded those PRVs, they can actually sell them to another company, and that often brings in sort of a large amount of capital back to those rare disease drug development companies, potentially money that they can use to really invest in continued R&D, and also an important incentive to encourage people to get into this space in the first place. Authorization for this vital incentive has expired, and we continue to urge Congress to quickly reauthorize. So very high level, I know that I covered quite a bit. I think that we do have, for reference for folks, a one-pager of our priorities for this year on our website. I'm sure that link will be shared soon. And then with that, I'll pass it over to my colleague, Mason Barrett, who will be providing some background on Medicaid and how the current political environment may impact Medicaid policies that we expected to see this year.
Fantastic. Thank you for that overview, Tori. And as mentioned earlier, my name is Mason Barrett, and I'm a policy analyst here focused on the coverage and reimbursement portfolio, including Medicaid, which we will be discussing today. So Medicaid is one of the most important health insurance plans in the country. It covers about 80 million people, nearly half of whom are children. Medicaid accounts for over a third of insurance coverage for children across the country and represents about $1 in every $5 spent on healthcare in the US, so a pretty significant amount. Despite its importance, Medicaid has been on a pretty bumpy road recently. During the pandemic, states were incentivized to keep folks on their Medicaid rolls through increased funding. When the pandemic ended, however, the funding went away, and the states began to redetermine who was eligible for Medicaid. This process was known as Medicaid unwinding, and nearly 24 million people lost coverage, mostly due to administrative reasons or procedural reasons, rather than being determined to be ineligible. Recently, Medicaid has also come under the microscope of the new administration and the majority in Congress. Congressional leaders are considering up to $800 billion in cuts to federal responsibility for the program nationwide through a few different mechanisms that we will address in a little bit more detail later on. Because of the way the program is administered, this means millions more are at risk for losing coverage. Before we go any further, I wanted to provide just a super brief overview of how Medicaid works, because it is honestly a little bit confusing. While each state runs its own Medicaid program, Medicaid at its core is a partnership between the federal government and each state. Each has their own set of responsibilities. On the federal side, laws are set outlining the rules of the program. Federal law requires states to cover certain groups of individuals, including low-income individuals, certain pregnant people, and children. and individuals receiving supplemental Social Security income. State Medicaid programs are also required to cover nearly all drugs, offer inpatient and outpatient hospital services, and offer coverage for laboratory and diagnostic services. One of the most significant roles the federal government plays in Medicaid is through what are called matching funds, also known as the Federal Medicaid Assistance Percentage, which I will refer to here on out as FMAP, because otherwise it's the true mouthful. FMAP funds are funds that the government gives the states to help run their Medicaid programs. The government reimburses states at different rates based on the per capita income level of the state, so that states with a higher per capita income level, like Massachusetts, for example, receive a lower matching rate than a state with a lower per capita income, a state like Mississippi. States also play a significant role in administering Medicaid. They fund about 1/3 of all Medicaid payments across the country, but it's a pretty significant strain on state budgets. It averages about 30% of a state budget kind of across the country. States set criteria for who can be covered by Medicaid and what additional optional services will be available to patients. While state Medicaid programs have to cover nearly every drug, states are also able to determine eligibility and utilization management criteria for each product. States can make it more challenging to access medications by doing things like restricting eligible populations to the clinical trial population rather than the FDA-approved label, or making patients receive prior authorization or step therapy. Finally, states can pursue changes to their programs through something called 1115 waivers. These waivers might do things that increase access to healthcare, such as extending continuous eligibility or increasing presumptive eligibility. They may also pursue waivers that make it more difficult to access healthcare, such as adding onerous enrollment requirements or requiring proof of employment. Next slide. So as I mentioned briefly a moment ago, there are pretty significant proposals on the table to reshape Medicaid on the federal level as a part of the upcoming budget reconciliation period. These changes could result in millions of patients losing access to quality, affordable healthcare. One proposal on the table is called per capita caps. Right now, the government funds Medicaid programs based on the actual amount of cost incurred. So that means that Medicaid funding likely fluctuates from year to year based on the growth rate of healthcare costs, the size of the population, and actual utilization of Medicaid. If a per capita cap were to be put in place, the amount of funding available to states would drop dramatically over time, leaving states with more and more burden of financial responsibility. A good general rule: as state financial responsibility goes up, the number of covered beneficiaries a state can handle goes down, meaning lots of people lose coverage. A second proposal on the table would be to eliminate what is known as the expansion matching rate. As part of the Affordable Care Act, certain populations are eligible for an enhanced matching rate of 90%. That's a significant amount of funding going back to the states, which makes it a lot more affordable for states to allow people who are previously not eligible to access coverage to get access to that coverage. As with the per capita caps, and as you can see on the charts on the right, the estimated enrollment in Medicaid would drop dramatically, including up to 50% in some states. And just for a little bit of a legend, I realize the font is a little bit small, but the darker states are the states where you're going to see more coverage losses. Some of the states you'll also see are grayed out. These are the states that have not yet expanded Medicaid, meaning their programs are still more restrictive and receive less federal funding. A third proposal would condition Medicaid coverage on whether or not a beneficiary is working. Work requirements are not new. States across the country have tried to implement them on a number of occasions, including in states like Arkansas and Georgia. Time and again, however, work requirements have been shown to be an unnecessary burden to people accessing healthcare. Studies have shown that the vast majority of people who receive coverage through Medicaid are working if they have the ability to work. Individuals who are not working may be full-time caregivers for a child or relative with a complex medical condition requiring round-the-clock care. As such, we're deeply concerned that any imposition of work reporting requirements would unnecessarily restrict care. The Congressional Budget Office estimates that over 1.5 million people could lose access to healthcare if work requirements were to be implemented nationwide. Next slide. On the state level, there are certainly some threats, but also some opportunities for Medicaid. So bad news first. If Congress passed a law cutting funding to Medicaid programs nationwide, 12 states have something that's called a trigger law in place, which would immediately eliminate expanded eligibility for Medicaid, meaning millions of people losing coverage in a heartbeat. States with trigger laws are both red and blue. including states such as Illinois, Arkansas, Virginia, and North Carolina. A number of states are also likely to consider submitting an 1115 waiver to permit work requirements if there is not a federal mandate. Though the Biden administration did not approve work requirements for the most part, with a small exception, the Trump administration is much more likely to be amenable to approving a work requirements waiver. We're paying close attention to states like Ohio, South Dakota, and Indiana where this may happen. Not all is lost, however. There's some great work going on in the states, both red and blue. Some states have recently passed or are looking into pursuing continuous eligibility provisions, which would make it significantly easier for certain populations to retain health coverage. In Montana, for example, a bipartisan bill is being considered in front of the Appropriations Committee that would extend continuous eligibility for children up to 6 years old for 3 years. That means that child would have 3 straight years of coverage. The parent would not have to worry about, whether or not that child is going to have to renew every single year. 3 consecutive years of coverage with no caveats there. Additionally, there's some positive momentum towards expanding Medicaid in states that have held out until now. Mississippi had some great bipartisan bills that unfortunately died earlier this year, but we also are looking at a bipartisan bill in Georgia to pursue a full expansion of the Medicaid program that is being considered in the legislature right now, and we're watching this pretty closely. Now, I'll hand this off to Carolyn, who's going to talk a little bit more about our state report cards.
Awesome, thank you. Good morning, good afternoon, everybody. So we'll be shifting over to the state level. My name is Carolyn Sheridan. I am the state policy manager for the Eastern region here at NORD. While federal policies really do set the foundation, state policies shape what patients experience daily, from Medicaid eligibility to insurance regulations and access to specialists. So that is why NORD created the state report card. This is not just a way to rank states, but this is a way that we can drive policy change. It benchmarks state policies, tracks progress, and gives advocates like all of us a tool to use in conversations with lawmakers. Every year, we release a new report card in January and February. We do this because that coincides or lines up with the time that many state legislatures are kicking off their sessions for the year. The goal of publishing the state report card is to show where progress has been made and where action is needed. We can bring the data to lawmakers to push for policy changes. We can compare how states are doing to one another to see where different states stand. And we can identify advocacy opportunities to protect and expand patient protections. So to give a bit of a high-level overview of how this state report card is set up, we will go through the 9 key issue areas that we at NORD evaluate. We're not going to do a deep dive. We are going to go generally on the overview here. So the easiest way to understand each of these 9 categories is by knowing and looking at the key question that we at NORD on the policy team are asking when we're doing this analysis state by state. So starting in the top left-hand corner, when we're evaluating states' Medicaid financial eligibility, really the key question that we're trying to understand is, does the state's Medicaid program allow all rare disease patients who need coverage to access it? States with higher income limits and broader eligibility will score better. Medical nutrition. What we're looking to understand here is, does state law require health insurance to cover medically necessary food and supplements? Some rare disease patients need very specialized formulated food to be able to live their day-to-day lives. So some states cover a wide range of conditions and others restrict access with limitations. When we're looking at newborn screening, we're seeking to understand if that state follows national newborn screening recommendations. More screening conditions would give the state a higher score. Protecting patients in state Medicaid programs. What we're looking at in this category is whether or not the state has used a Section 1115 waiver, which Mason explained to us, to expand or limit their Medicaid program. These waivers allow states to sort of tailor and customize their Medicaid programs. Some states use them to improve access, others restrict it, and we track both of those things. Protecting patients in state regulated insurance. This is a category where we're looking at how states regulate what are called short-term limited duration health plans. These are also sometimes called junk insurance. And these plans were originally designed to cover people during a short gap in coverage, but have expanded beyond that purpose. The problem with these plans is that they don't have to follow federal protections. They can exclude coverage for pre-existing conditions, refuse to cover essential treatments, and even drop patients when they get sick. And we know that our rare disease patients need comprehensive health insurance coverage. And unfortunately, this plan style does not always line up with that need. The next issue area we track is something that I think everybody is very, very familiar with, and that is rare disease advisory councils. What we're seeking to understand here is if that state has a council in place to guide rare disease policy development. 30 states have created an RDAC, and this year, me and my better half, Lindsay, are working in 10 states that have legislation introduced to create them and add to that RDAC community, which is a huge advocacy success. Looking at step therapy next, what we're seeking to understand here is, does the state protect patients from harmful step therapy delays? 40 states have some protections, but we do need some stronger policies nationwide. Telehealth, a very, very broad category of healthcare. What we are actually evaluating as part of our state report card is if the state allows specialists to treat out-of-state patients easier by being part of what is called the Interstate Medical Licensure Compact. And finally, our prescription drug out-of-pocket category. We're actually tracking a series of 5 different policies that states can choose to implement or not, that allows ways to kind of lower medication and treatment costs for patients. For example, does the state cap patient spending on rare disease treatments? Are there policies in place like drug cost caps and copay accumulator bans that may help lower patient costs? So where do states stand? Our 10th annual edition of the report card has been published. You can see our findings on the website now. And I do have some good news. Some successes in 24 show a lot of momentum, but it also shows where we need to protect wins and push for stronger policies. A really great highlight, all states now provide 12 months of continuous Medicaid coverage for children. Colorado, Hawaii, Minnesota, New York, and Pennsylvania all received approvals for similar continuous coverage for certain adult populations. 3 states joined the Rare Disease Advisory Council community in 2024, California, Michigan, and Mississippi. Vermont, Oregon, and Nevada banned copay accumulators, reducing out-of-pocket costs for patients, and Rhode Island capped out-of-pocket costs for specialty medications. But there are also some challenges ahead and trends that we're already hearing in the state policy community, such as the restrictions and the rolling back of Medicaid expansions that are on the horizon and might be possible for some states. And we are seeing that short-term or junk insurance plans might be a growing threat, given that they're regulated at the primary at the federal level, and the administration now in place is a little bit more welcome to those types of plans being in the market. The findings, though, do show that advocacy works when we all work together. We've made incredible progress, and by continuing to collaborate, we can protect and expand these wins for rare disease patients everywhere. So how can we do that? Whether you're meeting with lawmakers, testifying at hearings, or organizing advocacy days, this report provides the data that we need to drive change. If our state is falling behind, use the report card to show why change is needed. If our states have strong policies, we can work together to defend them and ensure that they remain in place. NORD also provides issue-specific fact sheets and state-specific reports, so you can dig deeper into these issues by yourself. The best news, None of us must do this alone. Our community engagement team is here to help us take the next step. And with that, I am going to be passing it over back to Leah to wrap us up for the day and to give us more information on what we need to stay involved.
Thank you so much, Carolyn. Okay, so how can you get involved? Next slide. There are many ways to get involved. I'd like to start with NORD's Living Rare study. Our Living Rare study is the largest and most robust observational online rare disease research study in the United States, created to gather information about everyday life with a rare disease. The study aims to recruit thousands of patients and/or caregivers who will share their lived experiences and challenges over the course of several years. Larger pools of data across a greater number of people will help us find solutions to challenges that influence and impact health outcomes and health equity. Please find out more about the study by visiting livingrarestudy.org, and please help us to spread the word. We really believe the study will make a meaningful impact for rare disease patients and families. Next slide. Join the Rare Action Network to ensure that you receive notifications about the upcoming virtual and in-person grassroots advocacy events that we are planning. We will be hosting virtual advocacy trainings throughout the year as legislative developments unfold and opportunities arise for you to take action. We will be hosting in-person and virtual Rare Action on the Road advocacy workshops throughout the country to provide information about NORD's programs and services, as well as to receive grassroots advocacy trainings on state policy priorities. We are also planning 2 Living Rare, Living Stronger regional meetings. They will be taking place in Oklahoma and Wisconsin this year. Those regional meetings will serve the community with in-person patient and family gatherings to address the need for candid dialogue, tools for self-advocacy, connection to much-needed resources and education, and an opportunity to participate in grassroots advocacy training. We are currently confirming the dates and locations of the events taking place during the first part of the year. We will provide the specifics of these events through our RAN network communications, NORD's website, and through our social media channels. You can also email us at action@rarediseases.org with any questions that you may have. Next slide. Story sharing. So Mindy touched on this earlier. Stories have the power to break down barriers, to find connections and common ground that one never thought might be possible, to ignite understanding, compassion, empathy, and most importantly, to drive actions and solutions. Here's a recent example of one of our fearless New York advocates sharing the story of her son, who's living with a rare disease, as they push for the passage of a permanent Rare Disease Advisory Council in New York during this session and as part of our Rare Disease Day activities. Thank you, Michelle, and to the many others who are sharing as part of their effort. They're having a lobby day in Albany next week to push. So good luck to everyone, and thank you again to Michelle for sharing. If you are interested in sharing your story, we would love to hear from you. We also love hearing stories and the perspectives of caregivers, clinicians, researchers, and all rare disease stakeholders. To illustrate the real day-to-day challenges of the lives of rare disease patients, we are collecting all rare disease stories. I would also like to make a call for Medicaid-related stories as we navigate potential cuts to funding and impose barriers to those receiving Medicaid coverage that Mason talked with us about earlier. We will drop our story sharing link in the chat, and you can also email us at stories@rarediseases.org. Next slide. So as you also heard earlier in the presentation, we have a chance to take action now. Your voice and your lived experiences matter. Let's come together to let Congress know where we stand. We will drop the link in the chat to our Congressional Action Alert so you can take action and urge Congress to get life-saving rare disease legislation over the finish line in 2025. Please take action today, and also please share this with your networks, families, and friends. Your advocacy is making a meaningful difference in the lives of rare disease patients and families. We can't thank you enough for making your voices heard. Next slide. And we would like to take a moment to thank our sponsors and our campaign supporters for their support. And next slide. This concludes our webinar. We will move into the Q&A portion, and we are so grateful again for your time today. If you have questions, suggestions, thoughts, we really want to hear from you. We want to hear what you're coming across in your communities. We would love to hear from you. So please email us at action@rarediseases.org. Thank you so much for your time.
Thanks, Leah. Thank you to all of our panelists. We're going to move into the Q&A portion of this virtual event. And the first question that I am going to ask is for Mason. And the question is, what happens to a child who is diagnosed with a rare disease and lives far from a care center, for example, in a rural area of Florida?
Yeah, that's a really good question. And this is something we actually see pop up pretty frequently. Oftentimes, children with rare diseases have to seek care out of state. So, for example, if you live in a rural area in Florida but need to get a specific treatment from a specialist in Boston, you'll have to fly and go see that provider there. Unfortunately, that is not an easy process. So one of the things that we've been advocating for recently, as Tori flashed up earlier, is the Accelerating Kids Access to Care Act. States oftentimes have pretty burdensome requirements for getting that care out of state approved, and the Accelerating Kids Access to Care Act would cut through that red tape and dramatically reduce the amount of time that it takes to get those out-of-state providers approved by the home state. It got pretty far in last Congress. Unfortunately, didn't make it all the way across the finish line, but we're hoping to see it reintroduced in the next couple of weeks. That's a bipartisan, bicameral bill with some really strong champions, so we are hoping to see some movement pretty quickly on that.
Thanks so much, Mason. The next question that I have is related to state policy, so I'm going to send it over to Carolyn. The question is, how do we access the state fact sheets? I think this person may be asking about the state report cards. How do we access the state report cards?
Absolutely. Yep. So you would go to the NORD website, rarediseases.org. You're going to hover on the driving policy issue topic right at the top of the page there to find NORD state report card. Once you get to the NORD state report card landing page, you have a few options for things, but what you are specifically looking for, Natalie, is the information that you'll find under the question, how does your state measure up? If you click the select your state, it brings to a drop-down list where then you can click on your state specifically, and it will bring you up to that landing page for that specific state and give you a walkthrough and a deep dive into how your state has performed on the state report card across every single issue area. And you can print those out.
Thanks, Carolyn. The next question that we have is related to Tori's presentation at the very beginning of our event. And the question is, which ones of the legislative issues have been introduced for the 119th Congress?
Yeah, thanks so much, Darby, and thanks to the person who submitted that question. So I know somebody helpfully plugged in one of the bills in the chat, but just highlighting here that on February 13th, Representatives Debbie Dingell and Michael McCall reintroduced the Give Kids a Chance Act in the House. And that's a bill to spur further drug development for pediatric patients. So among some of the other provisions, the bill does include reauthorization of the PRV or Rare Pediatric Disease Priority Review Voucher Program through September 30th of 2029. It also includes the RARE Act. So these are really two of NORD's top policy priorities, as I mentioned, that support important incentives for rare disease drug development. Just highlighting also that two other NORD priorities are expected to be reintroduced in the coming weeks. So one, Mason just referenced the Accelerating Kids Access to Care Act, and additionally the Telehealth Modernization Act. impact we expect to come up in the very near term. So NORD's been meeting with congressional offices and stakeholder coalitions really to drive support for these crucial bills and encourage their inclusion in the next moving legislative vehicle, whatever that is. So we continue to stay quite close on those issues.
Thanks, Tori. And then I have a question for Mindy. How did you overcome your fear of the unknown, especially regarding how your personal story ties into the advocacy piece?
That is an excellent question. And I found a mentor who had been there, done that, and they kind of coached me through the process. So I think that's the beauty of the rare community is we all have potentially different stories, but it's the rareness that connects us. And as I started to share my story and my impact with Rare with other individuals, they would kind of coach me and say, hey, this was an effective technique when I was talking with my representative or when I was trying to share my story. So finding someone potentially, and it doesn't even have to be the same rare disorder, it could be any type of rare disorder. Share your story with somebody and have them give you feedback on that message. And trying to get it down to a canned kind of 3-minute elevator speech. I think that is the ideal scenario because we all know that we are very, very busy. And if you can share your special message in a very small chunk of time, then that would be the best case scenario.
Thanks so much, Mindy. We have a question that I'm actually going to answer. The question is, I've signed up for the Rare Action Network, but how can I go about becoming an active ambassador? My family has a foundation to support rare disease research in honor of my son. Would this be a conflict? Anybody who's interested in becoming a NORD state ambassador, there's two kind of pathways that I suggest you take. One is to email action@rarediseases.org. The other would be to go to NORD's website, rarediseases.org. We have a Get Involved tab all the way at the right-hand corner of our website. It's a drop-down, and there's a volunteer application on that drop-down. You're welcome to fill out that application or reach out to our email, again, action@rarediseases.org. We would love to have you be involved in some way as a volunteer with NORD. And no, we have so many ambassadors that are involved with our member organizations or have their own foundations. So you're certainly welcome to reach out, and I look forward to hearing from you. All right. We have a few more questions. This one is related to the state report card as well. And it says, I went to the ranking of states on NORD's website, but it is a ranking list of them 1 to 50 overall, not just grades of each topic by state. So this one, again, related to the state report card, and I think I'll answer this one. So if you go to the state report card link that I dropped into the chat, there's really wonderful kind of interface where you can either select your state by drop down to find all of the ratings. That's kind of the way I recommend doing it. So say you're in Oklahoma, you'll just select the drop down, find Oklahoma, and then all of the topic areas that Carolyn covered in her presentation will be there, and you can see how your state ranks.
If I can add to that, Darby,
Absolutely.
in terms of, so if you want to see kind of like a nationwide view of that, there is not one landing page where it lists out like overall, you know, number 1 and number 50. Not quite like that, largely because it's not meant to be a ranking tool, but as a benchmarking tool, right? That said, if you do want sort of a nationwide view of how your state fits into an issue area, you can go to the issue area specific page and it will give you a graphic of the United States map with all of that shows all of the grades that the states received. So you can get a nationwide context of how your state sort of measures up within that specific issue area.
Thank you, Carolyn. We have another state report card question. Will you be updating the state report cards to include copay accumulator programs?
Okay, yes. So copay accumulator programs is a policy that we track within the topic of prescription drug out-of-pocket costs. So how a state gets a grade within that topic is actually, it depends on, here are 5 gold standard policies that we think states should adopt, and then more of them that they do adopt, the higher the grade that they have. So it can sometimes turn out that a state's grade may not have changed because they had already adopted maybe like 3 of these 5, which puts them in an A or B category. So the states that did adopt those copay accumulator bans, their grade may not necessarily have changed, but it was incorporated into our analysis.
Thanks, Carolyn. Okay, my next question is for Leah, and the question is, how can I get involved in advocating for state policies in my state? Or Carolyn, you're welcome to answer this.
I would say that a really great, before I pass it over to Leah to expand on additional opportunities, I think a really great starting point for advocates that are seeking to get involved with state advocacy work is to find out whether or not your state has a rare disease advisory council. And if it does not, it's very likely that me and Lindsay have an active coalition of advocates in place and working to see that council established. So the best way to get involved there would be to email rdac@rarediseases.org. And then Leah can speak to any opportunities beyond that.
Thank you, Carolyn. I would say we do have a lot of other upcoming state policy, as you heard today, other state policy issues that we are going to be working on. Some of this work around making sure that people understand what's potentially coming with Medicaid is to set the kind of foundation for us to be doing some of that work on the state level. And there are many other state policy issues. I would say if you have a specific interest in that, you're already a member of RAND, to email us at action@rarediseases.org with your specific interest, your state, and I can get back with you so we can talk more. All of the states are different. They're working on different things at different times, but there very likely are upcoming opportunities. So send us an email and we can talk further about that. Thank you.
Thanks, Leah. I have another question that is specific to New York. For the New York State Report Card, it says that there is a Rare Disease Advisory Council, but I can never find any information about that. Carolyn.
New York State is a interesting situation. So New York State created a temporary rare disease working group in 2019, which was then extended through a number of budget actions. And as of December 2024, technically that working group has dissolved or is no longer in place. And they did issue their report just before the end of 2024, which you can find now on the New York State Department of Health's website. That said, there is an active coalition and there are active efforts underway in New York State to establish a public and permanent Rare Disease Advisory Council in New York State. We will be gathering in Albany at the Capitol next week to further support those efforts. And we have a really, really great coalition that we always need more voices on. So thank you for asking.
Thanks, Carolyn. We have just a few minutes left, so I think we're going to wrap up. If anybody has any lingering questions or questions that you think of after the fact, you're welcome to reach out to us at action@rarediseases.org, and we'll make sure that your questions get answered. And I will pass it over to Leah for a few closing remarks.
I want to say thank you so much to the panelists. I feel like I learn something new every day at NORD myself. I am so grateful for everyone's time. Thank you, Mindy. It was so special to have you here today. We appreciate all the hard work and being an inspiration to the other volunteers. And I'm very grateful to everyone for their time today. Thank you so much.